So before going into the presentation, this is a little overview of the pinstick. Basically, I'm from pinstick, so this is called the nuclear Taj Mahal and physics today in 2015. This is the night view of this pinstick. It's a beautiful view here. So as you know that we are producing indigenously produced radiopharmaceuticals kits as well as radioisotopes for the indigenously for the hospital and supplied to the all nuclear medicine center in Pakistan. And this is the facilities molybdenum plant production facility. This one is a generator technetium generator facility and iodine production facility. And strictly onto the topic, because of short times, prostate cancer, some of the cancer which is the mainly in the men in the United States, which alone accounting for the 29% of the total cancer. And different imaging modalities, imaging agents for the prostate cancer are the cholines or MDPs or some androgen receptors and amino acid transporter, GRPRs and PSMA, small urea-based PSMA molecules. Out of them, PSMA is considered to be a good for the prostate diagnosis of prostate cancer, and as we know that PSMA is a trans glycoproteins having a molecular weight of 100 to 120 kilodalton. And PSMA is expressed in almost all type of prostate cancer, and its expression correlate with the progressions, stage and the risk of the disease as well. And the modality which been routinely utilized in the clinic is a gallium based or F18 based PSMA urea based inhibitors for the precise diagnosis, staging and monitor the response of the therapy. And obviously these are some precursor which are being utilized for that purposes. PSMA 11 labeled with the gallium 68, or similarly F18 labeled with some other PSMA molecules, and there is another PSMA 1007 labeled with F18. However, as we know that PET CT is not available to the all medical centers, only few hospitals has these facilities. And obviously it's very expensive production of galliums or F18. Obviously if they don't have a cyclotron, cannot be produced on sites. So alternatively, obviously most of the center have a small this PET CT. They can be technetium PSMA can be utilized to monitor the response or as well as staging and monitoring the response of the therapy in the patients. So there are different type of PSMA, technetium PSMA molecule which is being into the preclinical or clinical stages. One of them is PSMA technetium labeled. This PSMA molecules MIP1040, PSMA I and S, and PSMA HYNIC PSMA I PSMA, which is developed by the Mexican group. And there is one other PSMA molecule, HYNIC ALG, which is developed by the Chinese group, PSMA T4, which is developed by the Pol atoms. So there are different PSMA molecules labeled with the technetium is being used in the clinical evaluations of or staging of the prostate cancers. And obviously there is a debates about the diagnostic accuracy of technetium PSMA with the gallium PSMA. There are two images if you seen here. One is with the gallium and other one is with the technetium. Is there anyone tell which one is the gallium and which one is the technetium's image? Okay. This one is a technetium I PSMA, and on the right side this is a gallium PSMA. Obviously if you see, is you don't find any difference. Obviously the lesion are very much with the technetium I PSMA as well as gallium PSMA. Obviously, the resolution and the sensitivity is kind of, the quality of image is different, but you can see the lesions in the both images. So with this, we come up with the idea that obviously most of the center in Pakistan, they don't have a PET CT. So we try to develop the HYNIC ALG technetium kits for the easy preparation of this radiopharmaceutical at the hospital pharmacy. So this PSMA molecule is developed by the Chinese group, and it's a very simple molecule having a small urea molecule with the linkers. It don't have any lipophilic linkers. So, and then the chelator, HYNIC is used as a chelator. And they have studies this, and there are a lot of study with this molecule, and show very good uptake into the to the cancer, and it get prostate cancer, and it can differentiate, and it can localize into the mets of the and the lesion into the patient as well. So we performed some docking study, and this molecule show very high affinity with the PSMA, and we selected this molecule in our study. Then we calculated the KIV value. This is our docking and computational study basically. It show very high affinity with the PSMA. And then we synthesize this HYNIC ALG group by using a solid phase peptide methodology. I will not go into the detail. And obviously we will get finally this compound having a urea lysine kind of like a molecule, which is being used in this study, and as well as HYNIC as a chelator. So this molecule, we purified it and we characterized it, and then we prepared the radiopharmaceutical kits for this one, and we checked the quality controls by using radio HPLC and radio TLC as well. And obviously sterilities, endotoxin tests, we perform all of these tests to show a very good radio labeling efficacy and purity as well. And then we gave these kits to the different medical hospitals, and especially to the Kirans, and they perform some clinical study of this kits, and it show very good distribution into the to the body. And obviously lacrimal gland, if you see, is very visible here, which show a high expression of the PSMA, as well as a kidney also have a PSMA expressions, so it show uptake into the, and obviously the lesions show the here, if you see the lesions, it show uptake into the lesion side. So this showed that the kit is good for the diagnostic of the prostate cancer, as well as the metastasis in the patient. So this is a second case. It show very good uptake into the lesions. Lacrimal gland is very clear. So the kits is obviously working very fine, and it can be used for the diagnosis of the prostate cancer. And then obviously this molecule it don't have any lipophilic kind of linkers. So we thought that introducing because there is some publication and literature show that the PSMA pocket has a lipophilic kind of like pocket inside. So if there is any lipophilic linker into that PSMA molecule, it will show the affinity, higher affinity to that molecule. So we starting working on one other PSMA molecules, and we introduce one linkers. Obviously the previous one is a Chinese patent. Obviously it's very difficult. Obviously with the patent you can sell to the hospitals, and so we started working on another PSMA molecules so that we can have a different structures, so we can produce it at our pinstrick, and we can supply these to the medical centers. So we using the same methodology, solid phase peptide synthesis, and we finally come up with these molecules. Obviously here, if you see, the structure is a urea lysine molecule. However, here is we introduce this benzyl group as a linkers, as a lipophilic type of linkers, and obviously this is a chelator. So only difference with this molecule, the previous molecule, we introduced this lipophilic linker here to fit into the pocket, the lipophilic pocket of the PSMA. And then we obviously purification, characterizations, we performs. It's look very simple here, but obviously we need to pass into the various step and finally getting into this compound. And then we did perform the radio labeling and quality control studies, and obviously show very good radio labeling efficiency of more than 99%. We check with the radio HPLC as well. It show very good single peak into the HPLC. And we study the effect of the different factors, such as effect of reducing agent, effect of activity on the radio labeling efficiency, effect of incubation time. We did the optimizations at what time and what activity and amount of stannous chloride. The kits show very high radio labeling efficiency. And then we check the stability as well. It show very high stability until 250 minutes in normal saline as well as human serum albumin. And then we did actually, I didn't show it here, preclinical study into the mice to check the toxicity as well as normal distribution. Obviously, one thing we lacking here, that we don't have immunodepressant or skewed mice or bulb-sinued mice, so that we can inoculate any tumor into that, and then we perform the SPECT-CT to check that it show uptake here. And also the other limitation, because we don't have a cell line as well, so in vitro study would not be actually possible at our institute for the time being. So we did it in the normal mice only, and then we perform one case and we prepared this kit and we sent into the Nuri. They did one patient, and this kit show very good profile compared to the previous one. It show very good uptake into the lacrimal gland. If you see here, this prostate cancer lesion is very prominent here, very high intense uptake. So this PSMA molecule might be a good candidate for the monitoring or staging the cancer in the prostate cancer patients. So in the conclusion, we have synthesized technetium PSMA conjugates as well as a lyophilized kit for the easy preparation of this radiopharmaceutical at the radio pharmaceutical hospital radiopharmacy. And obviously this PSMA imaging can be used for the monitoring the progression, treatment response, leading to the more effective treatment option for the patient with the prostate cancer. And obviously still there are a lot of work to be done with this, obviously to compare it with the other like gallium based PSMA molecules, to check the diagnostic accuracy of these technetium PSMA molecules. And obviously we have a plan in the future to compare it with the other gallium PSMA molecules as well. And at the end, I would like to thanks to the all who provided the support for the development of this kit and radioisotopes, especially to Dr. Wasim here sitting here, is so encouraging for the development of this the project. And at the end, I would like to thanks to the Professor Yun Sing Lee, who is sitting here. He is a mentor to me as well and a good friend of mine. So I would like to thanks to him, and the other one, the personality here, Professor Jamin Jong, who retired. He is also mentor and a very good professor when I was there in the Korea doing my PhD. So at the end, I would like to say Kamsahamnida. Thank you very much. Thank you.
Thank you, Dr. Nadeem, for a very good presentation and showing the data from local peptide synthesis kits. If there is any question, please. Yes.
Nice presentation, but it looks that it's very simple here, that you take one drug to the patient right away, because you have to go through so many steps, international guidelines, before you can use your drug into patient. And I'm not very convinced, I'm not saying that, but the data you are showing that it is not FDA approved, GMP conditions, so all these guidelines, you know, to make sure, and then you need IND from your physician that is safe, you know. So I think one has to consider all these factors before they can use in clinical testing. Thank you.
Okay, thank you very much. I was expecting this question actually. So actually we got the consent of the patient as well as ethical review board approval. And as I told, I didn't actually, as I told previously, that we don't have a cell line obviously. That is we are lacking here currently in Pakistan. We are trying our best to develop this type of things here as well. And obviously you need to check the affinity of that radiopharmaceuticals. So you need cell lines or animal models. And currently we don't have these both. You are right, absolutely. We need to check all these. And obviously we have the lab here because we are producing the radiopharmaceutical kits GMP based at our facility as the Pinsticks. So we maintain all of the other criteria associated with all these things. The things which we are lacking, obviously the cell line study and as well as animal world. But we perform in the normal, as I told, we perform to check the toxicity as well as the distribution profile of these before going into the patients. And for the patient, we take the concerns as well as RIB approval in this case. Thank you.